Hi, my name is Dr. Tara Cully, and I am the staff dentist at the Good Samaritan Center in Fredericksburg. I've been asked to put together a little video talking to our Head Start parents about how to help their kids keep their dental health as good as possible all the way through childhood, and then hopefully they'll be able to maintain those habits and help them keep their teeth for a lifetime. So I first wanted to talk to you a little bit about why baby teeth are so important. They they really are. Sometimes I'll hear parents say, "Oh, but you know, these kids are about to lose their baby teeth. I don't want to spend money. I don't want to spend the time to try to save teeth that are just about to be falling out." And so it's really not true. One of the things I want to reinforce is that the pain that children have with dental decay and dental infection is just as severe as the pain that an adult goes through with a toothache. And so please don't discount their pain. A lot of times Tylenol is not enough to fix the problem. They are going through a long-standing infection that can be very painful. So we want to help our kiddos feel as good as possible. Dental infections can also be dangerous. Thank goodness that we have antibiotics now to be able to treat some of our severe cases, but in the past children used to die from dental infections, and so it's very important that we try to help our kiddos keep their mouths as healthy as possible. One of the other reasons that baby teeth are so important is that they help with the development of the adult jaw. And so if you happen to lose a baby tooth too early, then the adult tooth that should be coming in behind it doesn't have room to grow in. And so a lot of times you'll start having some severe crowding show up, and then you can also have impactions, which means that the teeth get stuck inside the jaw and they can't get all the way through, and so it leads to a significant problem where you end up having to have braces and significant types of braces, like things that take a lot of treatment to be able to fix. You can have lifetime chewing problems and jaw problems, all from not having or having to have your baby teeth pulled too early. So it's very important for a lifetime that a kid's teeth get started off on the very best as possible. Also, bacteria that causes dental decay is contagious, and so if your teeth, if you have baby teeth that have bacteria, as the adult teeth start coming in whenever they're 6 years old, the bacteria can move from the baby teeth to the adult teeth. And start infecting those teeth as well. So we really want the baby teeth to be as healthy as possible so that the adult teeth have an opportunity to come in and not get assaulted by those bacteria. The bacteria that is contagious is coming from a different source, and that's usually from birth. The caregivers are actually infecting the babies very early. And so we try not to have any type of saliva transfer from the caregiver to the baby, and that means trying not to share spoons and cups and kisses on the mouth and things like that, and that will help your baby keep from having that type of bacteria for longer. Now there is going to come a time, because we're all human, we do end up having this type of bacteria, but the longer that those children go without that exposure, the better off that they're going to be, and the fewer cavities they're going to have throughout early childhood. These types of bacteria that causes the cavities, the way that they cause the cavities is by metabolizing sugar. And so sugar is in all different types of food sources. carbohydrates like breads and rice and potatoes. And then it's also in fruits, and there's some vegetables that have carbohydrates. And then of course there's also plenty of refined sugars and candies and sweets and stuff like that. Now, we talk about foods a lot, but primarily what I have been seeing with the kiddos is that it's mostly drinks that are causing a lot of their dental decay, not near as much of the foods. And so if your child is having chocolate milk or soda or Kool-Aid, or the number one worst probably thing that they can possibly have for their dental teeth, for their teeth, would be juices. So if they are having any of those things on a regular basis, then they are feeding these bacteria. The bacteria are metabolizing the sugar into acid, and the acid is causing cavities and breakdown of the tooth structure. So if we can do everything we can to eliminate those sugars through the drink sources, your child is going to be much, much better off. So we recommend white milk, just plain water. If your child has already been accustomed to having something else other than plain water, then you can try implementing some little water drops enhancers that are sugar-free, and hopefully that they'll be able to transition to some type of sugar-free drink. Now, milk itself is karyogenic, which means that it does have sugar in it as well. And so that's cow's milk, that's also breast milk, and that's formula. If you are putting your child to bed at night with a bottle, and that's anywhere from 6 months old to 18 months old, if they're having to fall asleep with a bottle, and a lot of times they don't drink that last sip, and they have a mouthful of milk that sits on their teeth all night long. If they do that for 8 to 12 hours every single night for a whole year, then we end up usually seeing baby bottle decay, and that's where all of their front teeth get severe types of decay. As their back teeth come in, that bacteria then goes and spreads to the back, and so a lot of our kiddos, it's not only about what they're drinking now, but it could have been what they were drinking when they were 6 months old that caused the decay. And so if your child is beginning to show any types of signs of cavities, you will notice probably in the very beginning it's going to start looking like some yellow or white spots, almost a chalky appearance. And then as it progresses, it turns brown and black. And then that's whenever you start seeing abscesses, little pimples that pop up, and severe infection. So we try to catch cavities as soon as possible so that we can stop them and prevent having to do more extensive treatment for these kiddos. The very best way to do that is to come in every 6 months for your dental cleanings, and let us make sure that everything is healthy. If we catch things, we catch them when they're small so that they can be fixed easily. It's also really good to be able to help our children get to where they're comfortable in our dental chair, where they know that whenever they come in, they're just getting cleanings or fluoride treatments or, easy things, so that they are not scared of the dental office. And then if your child does end up needing dental treatment, we can certainly help you within limits here at the Good Samaritan Center. We have the ability to see patients in Gillespie County and then some of the surrounding counties as well. You have to be 200% of poverty or below, and so we have an eligibility coordinator. Her name is Zulema, and she'll be able to help you determine if you are going to be able to qualify for our program. If you need dental treatment, or your child needs dental treatment, we can help with extractions, fillings, and cleanings only. So if there's anything else more extensive, we're going to be referring that child to a pediatric dentist. If your child just has this severe amount of dental anxiety and is not going to be cooperative in our office, then we'll also send them off for more general anesthesia through a specialist. We have nitrous oxide sedation available And most of our kiddos do a very, very good job of, uh, you know, being able to take their dental treatment very well. So we are a volunteer clinic. I myself am on staff. We also have 2 other dental assistants. Their names are Courtney and Norma, and they are very great. You'll be talking to them. Norma is a Spanish speaker, and so she can certainly help you with any of your translation needs. And we also have 4 different local dentists and 2 hygienists that come and volunteer on a regular basis here at the Good Samaritan Center. So we can certainly try to help your kiddos if they need dental treatment, and then we can also help anybody else in the family if you qualify. So I'm going to leave my contact information here, and if you have any questions, please don't feel bad about calling us. Thank you.